Hey everyone, welcome back to the channel. If you're new here, don't forget to like, subscribe, and hit that notification bell so you don't miss any of our educational medical content. Before we begin, this video is for educational purposes only and not a substitute for medical advice. Always consult a healthcare professional and verify information with trusted sources. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that's essential for DNA synthesis, neurological function, and the production of red blood cells. It's found primarily in animal products, so deficiencies are more common in vegans, vegetarians, and individuals with malabsorption issues. Let's talk symptoms. B12 deficiency can present in a variety of ways. Hematologic symptoms include macrocytic or megaloblastic anemia, fatigue, pallor, and weakness. Neurologic symptoms can be particularly concerning with numbness, tingling, balance issues, memory changes, or even mood disturbances. Gastrointestinal symptoms may include glossitis, anorexia, and diarrhea. And in some cases, you may see skin changes like hyperpigmentation or vitiligo. So who's at risk? Let's break it down. Vegans and strict vegetarians, individuals with pernicious anemia, people who've had bariatric or gastric surgery, those with Crohn's disease, celiac disease, or chronic pancreatitis, chronic alcohol users, the elderly population, and those on medications like metformin, PPIs, or H2 blockers. When it comes to diagnosis, we start with serum B12 levels. A level under 200 is usually diagnostic. Levels between 200 and 300 can be tricky. This is where we bring in methylmalonic acid and homocysteine testing. Elevated MMA is more specific for B12 deficiency. Homocysteine can also be elevated, but is less specific, since it also rises in folate deficiency. If you suspect pernicious anemia, check intrinsic factor antibodies or antiparietal cell antibodies. Here's a quick summary of how to interpret lab findings. A B12 level under 200 usually confirms deficiency. A level between 200 and 300 with elevated MMA or homocysteine suggests subclinical deficiency. A level over 300 with normal markers makes deficiency unlikely. Always remember, if you find a deficiency, investigate the cause, especially if it's recurrent or unexplained. Treatment depends on how severe the deficiency is and whether there are neurologic symptoms or absorption issues. If the patient has severe anemia, neurologic symptoms, or malabsorption, the preferred regimen is 1,000 micrograms of intramuscular B12 daily for 1 week, followed by 1,000 micrograms every 4 weeks as maintenance. This may be lifelong if the underlying cause is irreversible. If those features are not present, start with 1,000 micrograms IM weekly for 4 weeks, then switch to monthly dosing. Adjust based on follow-up labs and symptom resolution. Oral therapy with 1,000 to 2,000 micrograms daily can work for dietary deficiency or those who prefer pills, assuming reliable absorption and good compliance. Monitor treatment effectiveness with reticulocyte count, which should rise within 3 to 5 days. Hemoglobin and hematocrit should normalize within 6 to 8 weeks. Neurologic symptoms may take longer to improve and may not fully resolve if the deficiency was prolonged. Recheck B12 levels or MMA if there's any concern about treatment efficacy. A few clinical pearls to remember. Never treat folate deficiency alone in someone with suspected B12 deficiency. It can mask anemia and allow neurologic damage to progress. Patients with pernicious anemia will require lifelong B12 therapy. Check for iron deficiency in patients with macrocytosis to avoid missing mixed anemia. And that wraps up our deep dive on vitamin B12, how to test, who's at risk, and how to treat depending on the clinical picture. If you found this video helpful, give it a thumbs up, share it with your fellow med students or colleagues, and comment below if you'd like to see more content like this. Subscribe for more evidence-based medical insights. Thanks for watching, and as always, stay curious and stay informed.